Hi, my name is Cassandra Hall and I'm one of the Skills Lab instructors here at Montgomery College, and today I'm going to show you a little bit of what we have here in the labs. Now, I'm quite sure some of you alumni have used to be over on the other side of the campus in the old labs. Well, I'd like to show you what we have now here in the new Health Science Center. In here, in this particular lab, we have the open campus lab where we have different students come in here to practice their skills. What we like for them to do is to come in, practice whatever given skill that their instructors have assigned them, and they're there to practice them, and then as they go into the clinical setting, they're to perform those clinical skills with their patients. For instance, we have an Asian mannequin, and this particular mannequin basically is just what we call a low fidelity, which means that the patient does not, or the mannequin, we're so used to calling them patients, but the mannequins doesn't breathe or they don't have any other kind of functioning, but basically they're just a regular mannequin that they can perform different skills on. So here's our little Asian bunny. Over here we have another patient, and if you don't mind me calling them patients, because here that's what we call them, we have this particular patient who may have certain apparatuses attached to them, like a central line or a trach. Also, they may have Foley catheters and G-tubes, gastrostomy tubes, and other things so that the students can perform their skills. Another thing that you may not have had back in those days is we have the medication that's put on the computer. Now, this particular machine is what most of the hospitals have. Here we have what we call the med dispense, and this is a way that the students can take a handheld scanner, and they scan the patient's arm bracelet, and they also scan the medication, which helps the accuracy of who and what the medication that they're giving. Another diversity of our patients here. We have African American patients, as well as Hispanic patients, as well as Caucasian patients. So we try to be culturally diverse because this is a culturally diverse environment. As you can see, there are students in the background, and they're practicing their skills, and with their practicing, they have to be tested. So they're getting ready for their tests sometime this week. Mannequin that we have, or as I have said earlier, a patient of ours who can actually breathe. We can hear the heart sounds, the lung sounds, the bowel sounds. Also, we can take a audible blood pressure, and also he can exhibit a pulse ox, which is measuring his oxygen level. And one other thing that's really cool about SimMan is that he talks. But let me show you how we can do all that. We have the monitor here, as you can see, just like a real hospital, where you can have the EKG and all of his vital signs posted on the monitor. How does all of this work? Well, we're living in a computer age, and let me tell you, it is a very high-tech, sophisticated way of utilizing this equipment for the students' learning. In this control room, as you can see, we have two monitors. So we have a room on this side, the room that we were just in, and then we have another room. We're able to control the vital signs and any function of the mannequin or patient, as I have been saying. For instance, I did mention that the patient could talk. Well, what we have on our computer here, everything is mandated or is controlled by us using the computer and the mouse. And this particular patient can, as you can see, you can hear the different sounds of the monitors. And if he says something, we just click here.
No, I don't feel dizzy.
See, he doesn't feel dizzy. And we can turn up the volume.
No, I don't feel dizzy.
or other things he might say. But I think the student's favorite one is when he has to throw up. What we call a medium fidelity patient. Basically what this patient cannot do, you cannot see his breathing actually like we did with Man, which was the high fidelity patient. But with this particular patient, you can monitor and hear his lung sounds, his heart sounds, and you can actually do a blood pressure. And he's very limited on his speaking. He may cough or moan or say yes or no. And that's basically what our medium fidelity patient can do. But it's very important that the students, when they're doing their head-to-toe assessment, that they learn and try to hear the different types of heart sounds and lung sounds. Let me show you an example of our examination room. As you can see, we have 5 stations that look just like this, where we have the examination table, we have a blood pressure cuff, we have the otoscope, and any other things that the students may need in the drawers, alcohol, swabs, gloves, anything that they may need for their physical assessments. This particular course is a 1-semester course that the students have to take in their first semester of their program. Well, this wraps up of what I have shown you, which is not really as much as I could have shown you, because you've only seen just half of what we have here in the lab. I wonder if you ever, as alumni, can you remember what kind of equipment or tools like fruit that you used to use for your equipment? It seems like, you know, now with technology, we have come a long way. So I just like to say, you know, I think this is the most wonderful thing that we have here at Montgomery College, and we're even expanding even more. So as you can just stay tuned, because there's more to come.